All right.
Hi, everyone. Welcome to House Healthcare. It is Tuesday, April 18th. You'll see a split screen here. Unfortunately, I am home for the day and it looks like everyone else is in the committee. So for this hour, 45 minutes to an hour, we're going to talk about S36. We talked about this last week when Judiciary came in, told us what's happening on the bill. We had some questions that we wanted them to get back to us on. They could not be in committee with us today because of testimony they're hearing. So what I thought we would do is walk through the question and answers again, and then open it up to conversation. That works. So everyone in the committee got the email from Joe, and just raise your hand or just if I need to stop. It's really strange not being in the room. So one of the first things we talked about was in the original bill, it had said healthcare facility, and we've narrowed it down, or Judiciary has narrowed it down to healthcare, hospital. And the Judiciary Committee decided on hospital because that's where the testimony, they've heard the testimony, that's where the issues are happening, and that's where the concerns are from other witnesses. They have expanded it to EMS, since EMS often are the ones transporting to a hospital and then could potentially be staying in the hospital as well with their transport. So the language did extend it to that, but not healthcare overall. And I know we had some discussions about potentially looking at it again next year once we get some data back to see if we need to expand this to all healthcare. Any questions on that? Comments? All right, so then the next one was section 5, which is the Department of Public Safety report on arrests without warrants. Unfortunately, they've had testimony from Department of Public Safety indicating that they can't provide us the data that's in the report. So they've changed the language to indicate that they need to come back with what would be required. So I think if I can figure this out, I am going to share my screen so everyone can see the language. We'll see if I actually get this right. Can you see the language?
Yes.
Okay, great. So section 5 here, Department of Public Safety. So they've struck out the original language and they've added this, and I'll just read it. On or before January 15th, 2024, the department, so that will be when we're back in session, the Department of Public Safety shall report to the House and committees on judiciary, and I'm going to have them add in healthcare, on any systematic or statutory changes needed to permit the department to collect data on arrests pursuant to Vermont Rule of Criminal Procedure. The report shall include changes necessary to collect data on the number and demographics of persons arrested, the town, county, and type of healthcare facility, which we had asked to add in, where the arrest occurred, and the number and types of charges filed after the arrest.
Can you, Lori?
Go ahead.
Yes, yep.
Yeah, can you help me understand the difference between the first paragraph and the second paragraph?
So the first paragraph was saying that they had to provide the data. The second paragraph is saying what any systematic or statutory changes are needed for them to get access to the data to then be able to report on the data.
Okay, to allow data collection.
Yes.
Got it. Thank you.
So unfortunately, it means, a delay in actually getting the data. On the positive note, they did add in a request to put the type of healthcare facility so we could get some more information on that. Mari?
We have Vaz in the room. Is it okay if I ask them a question?
If they are willing to.
Yes. So I know we're talking about section 5, but I'm wondering if in the section 4, in the report with stakeholders, including hospital employee stakeholders, that includes centralized reporting, ongoing assessment of visitors and patients for aggressive behavior, is it possible to capture some of the data that DPS can't get, like demographic information?
Yes, Devin Green, Vermont Association of Hospitals and Health Systems. Yes, we will report on that data.
Great. Thank you.
Great. Good question, Maureen. Thank you, Devin. All right, so then the last issue we had brought up, and probably one of the most important, is equity. So we were concerned with testimony that had been provided early on back in the Senate from the, I forget which office it was, Office of Racial Equity, I guess is the official name of it. And this was a judiciary response. We feel very much the same as the Healthcare Committee about equity being a very important part of this bill. We think the report from Section 4 of the bill will help us to ensure that it is being monitored, as will the Section 5 report when DPS can start reporting out. Any comments or thoughts or questions on that? Concerns still?
The one over here, Cory.
Sorry, so go ahead, Todd, and call on them because I can't really see.
So I spent some time looking at that report, and then also from Lindsay Owen and Meg Folate. I don't know if I'm saying her name. There was some information coming in from the Disability Rights Organization and also the policy director of the Vermont chapter of dementia, and they had some concerns about the bill as well. And so I just wonder how we dialogue about that. If the Office of Racial Equity just has concerns, and there's concerns from these other stakeholders, and also concerns that there's already these laws on the books. I'm just curious as to how we dialogue about that way, because there's a huge crisis happening.
Right.
So, and we want to support our healthcare workers. So I'm kind of at a loss.
Yeah, so I'll let Mari go first. Go ahead, Mari.
So I had a long talk with one of the emergency room nurses who's a friend and a colleague that has testified both in the Senate and for House Judiciary. And then just my experience of having worked with people with aggressive dementia for a long time. There are, before we get to the point of a warrantless arrest, first of all, it is highly knowing our systems that we would get to a point that we would arrest someone with aggressive dementia. And there are so many stepwise, well-tested procedures in place to address issues like that in hospitals already, including de-escalation. And then when we've tried everything else, then one of the next steps would be chemical or soft, not like the restraints you saw the other day. These are truly soft restraints to keep the patient from hurting themselves. I have never seen a situation where someone with aggressive dementia would have had to have been arrested.
Say that again, Mari, you touched that one.
I have never seen a situation where someone with aggressive dementia that behavior would cause an arrest. We are trained and skilled and have so many stepwise procedures in place to protect patients with that behavior and protect hospital employees. That it's a valid concern, but we as healthcare workers are not wild about having to use warrantless arrests as a tool, and that's all it is. It's a tool in our toolbox. When we have tried everything else, patients they don't have dementia, they're clinically stable, and they're throwing chairs and they're choking staff and they're kicking pregnant nurses in the abdomen. They need to be removed from the situation. In the meantime, in the emergency room, there are a lot of other patients that need care. And when that person is doing the choking or whatever the behavior is, it's pulling staff from all the other rooms in the emergency room because they're running to try to to contain the issue. So people aren't getting care, then there needs to be an intervention, a reset to remove the person from the emergency room.
And that can't be done now with the current laws.
So-
And they can't put the security in the house. So I guess that's my question, because it seemed like some people in the testimony said that it can be, and they're seeing this as duplicative, or that it may have possible harm in other ways. And so I'm just curious as to that scenario that you wrote, it wouldn't, security couldn't step in and remove.
So security is another issue. Some hospitals don't have security. Other hospitals, like our critical access hospitals, have, we'll say a night shift in the emergency room, have 2 nurses, 1 physician, and 1 security person who's not a law enforcement officer. Probably doesn't carry, we don't want them to have I'm not saying they should have weapons, but there's security. Sometimes their stature is petite. They might not have the physical capacity to intervene when there's an assault. And again, some emergency rooms in hospitals don't have security. There's no one there that can help, but a small number of staff who's also trying to manage other patients. So what we heard in testimony in the Senate and in the House is, yes, there is that debate about whether current law already addresses those issues. And it's clear that it doesn't, because there are many instances where the employees have tried all the other steps in the process. They're unable to contain the behavior. I've called law enforcement. Law enforcement either doesn't come and says they can't because they're not legally protected, or they'll come and then just stay outside, kind of throw their hands up in the air. So this, and maybe Brian, you can clarify more since you work in the emergency room and issues like this. So this would make it really clear that law enforcement, yes, could come in and remove the person from the situation. Staff can get back to caring for all of the other patients, provide a reset. And I will also say, reiterate what I said earlier, staff are not wild about, they're not wanting to call the law enforcement into the emergency room. They're just not, unless it gets to that point. So there's an issue that you may have seen in the news where the interim chief of police in Burlington was actually trying to arrest a healthcare attending, because the attending would not let the police officer take the patient, but the patient wasn't clinically stable. So healthcare professionals are really good at assessing, when it's appropriate for someone to be okay leaving the emergency room, and when it's not, and they'll be really fierce about protecting their patients. The last thing I'll say is what I heard from this nurse was a few things, and from other healthcare workers that work in the ED. People are leaving because they don't know if they're going to get to work and actually survive that day working in the emergency room, if they're either going to be injured or killed. And that's the level of fear now. Going to work on a daily basis. Am I going to make it out of here alive? The other thing she said was that knowing that this bill is starting to is moving through the process and might be passed, is providing a sense of relief already to hospital employees.
I just want to say, I totally support what you're saying and wanting to protect. I just thought when you said worried about getting out alive, that breaks my heart to think of our nurses and healthcare professionals having that experience. In the same breath, I worry also for people of color and Black people that have that same feeling when they are facing interactions with police. And so I want everyone to get out alive, and I just want to be able to talk about that. So I appreciate your sharing, because I didn't get to hear that testimony directly.
And
I agree with you, and the nurse that was testifying is Black. And we're all in agreement on the health equity issue. And that's why I'm really glad that if the Department of Public Safety can't gather data, at least the hospitals can gather that information. And Representative Carles Rubio and I talked about, I think it would be useful for whoever's interested for us to visit our hospitals during the summer and the fall and follow up on this. Just check in and see how it's working out, how people are doing. And I think both of those instances where patients, historically, BIPOC patients and LGBTQ patients have been disproportionately impacted negatively by interactions with law enforcement. The same group of people are being disproportionately impacted. The healthcare workers that are being attacked in the ER. So I struggled with this too, and I came to, we have to do both at the same time. Yeah.
And I also just want to say, kind of back to process, Melanie. So, you know, the Judiciary Committee, just like we would if this bill was in our possession, would be taking extensive testimony. And although they did not take testimony from Office of Racial Equity, they did hear from Disability Rights Vermont chapter of Alzheimer's Association and Dale. So just like we would weigh that with everything, all the other testimony, we have to trust that they did that as well.
And I saw that. Yeah.
Okay, great. Yeah. And the good thing is the first report, well, I say this, I don't know when the first report from the section 4, sorry, I don't have it in front of me now, has to be done, but we'll be back in session in January, and we as a committee can take our own testimony on, the impacts of what hospitals have seen so far, if this does pass and takes effect July 1st. So
Two other questions, Madam Chair.
great. If Topper, if you want to call on people, that'd be great.
Yeah,
Yeah, and I guess it's more of a comment than a question. Just to kind of back up what Mari says, I think this is a really important bill. I think it sends a message to our healthcare workers that we care about them. I think we should err on the side of our healthcare folks. And I think we have to have a level of trust with law enforcement that they're gonna do things the right way. I think they're trained enough and able enough to not overstep their bounds, to use their power sparingly. But the fact that are able to be called, I think, is a real advantage. So I'm wholeheartedly in support of this, because we've just heard too many stories like Mari just told us. If one healthcare worker in the state is hit by someone who knows better, okay, that to me is totally unacceptable, just totally unacceptable. And I think that we need to take some steps to take care of it. So.
okay, thank you. Penny?
Well, basically the same thing. I think this bill is way too important to start trying to change it in that amendment, because if we do too much, would we have time this year to enact everything you're interested in? Or let's do this and then work on continuing equity and even further building, security buildings as far as clinics and stuff. So I think all providers should be. So, but I'm willing to do this and then come back and work on I think this is too important to start changing this time of year, but maybe I haven't been here. Maybe we can get this done this quick. I'm not sure.
We'll see. Leslie?
So I'm just wondering who implements it. There's a lot of law enforcement in our state. There's local, there's state police, there's, what's the other one I'm blocking out? Sheriffs. So who makes sure everyone knows that the law is in fact in place for warrantless arrests? and can do it in a way that is appropriate? How does that get out there?
I have absolutely no idea, Leslie.
That's a good question.
That's reading from Buzz. My understanding is that this would, law enforcement would educate everyone on this. My understanding from what I've heard from law enforcement officers is that they all have Rule 3 memorized. And so this would just add to that and, show them the importance of responding to workplace violence in hospitals and units.
So it comes out of Department of Public Service, then says this bill is passed, and there you go, or who's in charge? I guess, yeah. Or maybe they're all in charge. I don't know.
So Leslie, I would suggest that you talk to someone on judiciary to get that question answered. They would know the
Okay.
answer.
Thank you.
Okay, Brian?
Is this just questions or is this committee discussion?
A little bit of both.
Because I don't have questions. I just want to share my position.
Sure.
I oppose the bill 100%, and I want to explain why. I think that it would create a false sense of security and relief for staff, but the reality is that the police do not keep us safe, and research shows that improving the social determinants of health is what actually improves public safety and public health, and that state violence is actually, it has a negative impact on public health and public safety, and I have research that I'm happy to put on the record even if needed, even though I'm not a witness. Public health research proving that. Violence, that this is not going to keep anyone safe. And in fact, it might make things more dangerous because research shows that violence leads to more violence. And Martin Luther King said violence begets violence. And it goes back to Jesus, who said in the Garden of Gethsemane to his people not to strike back against the soldiers because it's just perpetuating violence. But I mean, research has proven what faith has taught us for thousands of years. Violence is up nationwide. Why? I think that a lot of people are trying to figure that out. But one strong thing is that the pandemic has interrupted life and disrupted the social determinants of health for people. People are struggling and acting out, and then that violence is met with the violence of the state, which is perpetuating more violence. And I feel like we're caught in this endless cycle of harm. As a healthcare worker in the emergency room, I see it, other staff may disagree with my position, but it's not because I don't understand it. I have been in situations where I've been emotionally and physically hurt before, and I'm not even going to get into it, but it's bad. And I've never seen nurses cry as much as I have in the last year. Not just because of the violence, but because of the level of intensity of suffering that is happening out there. And the emergency room is like a point at which it all is concentrated because everyone is dumped there now. So I guess what do we do instead? I want to put it out there, even if there's no time to change this bill, so be it. But I think it's not enough to say no. I need to at least present an alternative. That I think nonviolent communication and de-escalation needs to be deployed immediately as an emergency measure. And the Burlington emergency room, to me, is my world. I'm not in the other ones, but I feel like a lot of this has been guided by UVMMC's emergency room. I feel like a lot of the testimony of the nurses I've heard from, that's where it is. So if that is the hot spot for violence against healthcare workers, then let's use the emergency room and the Burlington Police Department as a pilot project. And we already have Team 2 training, which I signed up for, and I'm excited to do as a crisis worker, where we're going to train with the police and have a common language. Why don't we do something similar with the emergency room and law enforcement, where we train all of the staff, every single person, the custodial staff, the nurses, the social workers, the doctors, the police, the security guards, in a common language of nonviolent communication and de-escalation skills, and do it as an emergency, do it ASAP as quickly as we can. And this is really important in that everyone speaks the same language. So when something happens, we're all reacting in the same way. Because one of the things I see in the emergency room is that one person will calm someone down, and then one other person comes in and says the wrong thing, and it blows up. And so if we all were approaching it from the same angle and working better as a team, we might prevent some of these incidents. We're not going to prevent them all. And I want to be honest, we still are going to need a response when things get out of control. But what I heard from when I reviewed the testimony that I wasn't in the room for was that the existing law allows it, and there's just people aren't following it. So I'll come back to that in a second. I heard, about how there are federal level regulations and rules around hospitals needing to take care of security. And I think that our hospital has, for whatever reason, not been able to manage it. It's not a critique of the workers. I actually think it's at the administration level. And I want to point out that at the hospital in Burlington, that the police have killed someone, that there was a man in the parking lot who was punched by the police and died days later. And when the community demanded that officer resign, he didn't. And the mayor of Burlington asked the examiner of the state, the chief examiner, to change his ruling so that it wouldn't be a homicide. But it still came out that this was a homicide. So people were trying to kind of steer it away from what really happened. And then what's especially frustrating to me is that the mayor, I think this needs to be public. The mayor of Burlington met with the Burlington delegation and asked if someone would follow up on this issue. And I said I would, and no one got back to me for like 2 months. And so I reached out, and then I met with Dr. Leffler and staff from the hospital, and they were saying that the reason there's a problem is because we've cut the police and it's defunding the police. There's not enough cops. And they did this with knowledge that the police chief of Burlington went into the hospital and threatened to arrest staff.
Okay, Brian, you're getting way off of the bill.
Well, I'm bringing it back to the bill though, because it's important though, because this happened while there was an election for community control of the police and police oversight. So the community knowledge about this issue was kept from the community while an election was happening where it might have influenced community oversight of the police. So we have a situation where there's no meaningful community oversight of the police in Burlington. We have a mayor who's pushing forward with the appointment of a chief, but we want to increase the power of the police to arrest people in the hospital.
I'm asking you stop for a moment, please.
Okay,
So Brian, I completely hear where you're coming from, but we are not talking about community oversight of the police on this report, on this.
But I know, but it matters because we're increasing the power of the police in this.
Okay,
Allegedly.
What I thought you heard though, with some of your suggestions of no, I get it, but hey, you're coming forward with some ideas, which is fabulous.
Yeah, you want to hear the ideas?
I'm sorry?
Do you want to hear the actual ideas?
Well, some of it was training.
Yeah. I'm at the end of what I wanted to say anyway, the point I was making is that there's a lot more going on here than we're talking about. And we need to take into account when we make this decision that it's not simple. But here's what I think we should do. That the Department of Public Safety or another body should immediately issue a memo to all law enforcement in the state clarifying the existing procedures so that everyone knows that they can do this under existing law and that we don't have to codify it any further. That I think that the state can launch an emergency training starting with the emergency room at UVMMC in nonviolent communication and de-escalation. And I think that we need to give hazard pay for the workers in the emergency room at UVMMC until there's a measurable reduction in violence towards the staff. Those are my suggestions.
Okay, thank you, Brian, for that. I will say back on the first one, which was about training, Section 4 will help us get to some of that, as well as how to make it safer in hospitals and hopefully not have to rely on the police. I also want to be clear, this is not just about UVMMC's emergency room. This is a statewide problem. So Brian, your ideas, they're not really for our healthcare committee, but I'm happy to talk offline on how we can talk to some folks so you can be heard if that's what you're looking for.
We have another question. Question. Larry?
So you said what I was going to say, that we put section 4 in there just for that reason, to have the stakeholders, including union members, frontline workers, be part of a process of creating systemic improvements. So that's what section 4 is about. Just a reminder that we're also talking about critical access hospitals, not just UVM, where there is no security or minimal security. And then I feel like as a frontline worker who does experience violence, even on the inpatient side, that I want to know that if things are really critical, like someone's being assaulted in a public space in Middlebury at a convenience store, that the police will come and intervene and make an appropriate arrest. If it can happen there, that someone will protect us as well.
Okay. And Brian, the things you brought up, they will fit in there. If you look at that section 4, I think you could, a lot of that information could be put in there. Okay.
Are we,
Madam
any other
Chair, we're all
comments?
set here. We're all set here.
Okay, any other comments before we do a straw vote?
I'm
Go ahead.
I'm surprised at the lack of mention of people with mental health challenges or suspected mental illnesses. It looks like judiciary, or maybe it was Senate Health and Welfare, took testimony from the Alzheimer's Association and other entities, but there's no specific reference to individuals with mental health issues. And I would suspect that they are commonly impacted by legislation like this. And also, so that's my number one concern. My number two concern is how this policy is perhaps intertwined with another one that we recently looked at regarding transport. And so I look at this through the lens of a person with mental health challenges and how my decision is going to impact their experience if they land up in the ED, which is where a lot of us might. And I have concerns.
Daisy, in section, on page 6, is there anything in there that might deal with what you're talking about?
Page 6.
Page 6, yeah. Sec 2, small 2. And in the paragraph before that too, talks about not removing that person until they're stabilized and so on. Is that the kind of thing you're talking about?
Hopper, excuse me, you're talking about the last paragraph.
Well, it's on page 5 and 6, and it talks about a person who's not stabilized yet and what has to be done before they can be removed.
Or if they're being transferred to an inpatient facility,
Yeah.
like
No,
Brattleboro.
It's not just, the transfer is a separate bill, but I think this is just their experience as a whole. I'm not clear whether that was really directly spoken to in testimony. I saw that the Alzheimer's Association was able to kind of lift up their concerns around individuals with different types of dementia and how those behavioral symptoms might exhibit themselves and what some of the ways that might impact their constituents. And I'm not clear whether anyone took testimony other than it looks like Representative Donahue sent something in. I'm not clear whether there was enough testimony from individuals with mental illnesses, and I'd like to see more than Representative Donahue's personally. That's my concern.
Okay. So we can tell judiciary that concern.
Yeah, and over here we have another,
Yeah, I will just say Jack McCullough from the Mental Health Law Project did testify in House Judiciary on the issue.
Thanks, Devin. Alyssa?
one,
Well, since everybody else is weighing in and you all make wonderful points, it's no secret that I wasn't a guiding principles supporter. However, I've spent a great deal of time looking at the guiding principles today. The reason I didn't ever really like them is that because they conflict with each other and we have to make really, really hard decisions sometimes. And I just keep coming back to supporting and valuing our healthcare workforce so they may provide excellent care and meet the ongoing needs of the people of Vermont. And when we don't support our workforce, all of us are robbed by an effective healthcare system. And so I'm in support of this because I'm supporting our people who are afraid to go to work. Shouldn't have to be.
Thanks, Alyssa. All right, so sorry for the time frame, but we do have to do a straw vote because I have to go to a probes. So all those in favor? Yeah.
I feel uncomfortable having it framed if we have questions about the bill that we're not supporting workforce or healthcare providers, because I'm just reading some of the testimony and I did over the weekend, and people were concerned that it might, that there should be some more consideration perhaps about what the effect this might be on populations that are coming into the hospital, like people with disabilities and whatnot. So I want to just be careful that if someone says that they have questions about the bill or votes differently, it's not that you're not in support of healthcare workers, because 100% support it. I feel we're in a crisis. I feel we need to help them. But if we have questions, not because I personally don't care about them, or other people may not be feeling the same way. I just don't want it framed like that.
Thank you, Melanie. That's a really, really, really good point. We're not pitting one group against another. This is a yes vote if you agree with the policy. It's a no vote if you don't. I suspect we will absolutely be coming back to this next year once the reports are in to make sure there are no unintended consequences with this. Okay, so all those in favor of S36, raise your hand. Topper, can you count?
7?
7?
Lori also 8.
Oh, I'm sorry. I didn't see it.
You see
8.
No, it's Lori.
No, Lori, you didn't count Lori.
Oh, Lori.
8. All those voting no on S36. 3. Great.